Introduction to the Endocrine System Anatomy and Medical Surgical Nursing. Hi, all Alveoly E-learning students. Let's have a look at revision of the endocrine system in terms of anatomy and physiology, medical and surgical nursing. Before we begin, let's look at some important points in anatomy and physiology of the endocrine system. During lessons in anatomy and physiology, we were made to understand that cells forms the basic structural and functional unit of a living organism. However, when two or more cells combine to form a particular function, we call it tissues. When two or more tissues come together to perform a particular function, we call it organs, and when two or more organs come together to perform a particular function, we call it systems, of which one of the systems is the endocrine system. Whenever an organ produces secretion, we call that particular organ a gland. However, if the secretions passes through a tube connected to the gland in order for the secretions to get to its destination, then we call that particular gland as an exocrine gland. So let's look at the bulb syringe, popularly used for enema as an exocrine gland, because upon squeezing the bulb, it causes release of secretions through the nozzle, or its syringe, or a tube connected to it. So you could see that the secretions have to pass through a nozzle or syringe, or a narrow tube, before the secretions come out. So let's assuming the round portion to be the gland, and the nozzle to be the tube connected to the gland, where the secretions pass through to their destination. Examples of exocrine gland is the salivary glands. Then we call this type of gland exocrine gland, because it has a duct connected to it outside to enable the secretions to be moved out of the gland. Hence we call this type of gland exocrine gland, because it has a duct connected to it outside to enable the secretions to be moved out of the gland. Now let's look at another scenario where you have one of the 10 paillasses, pure water, in your hand, and you make small holes and squeeze it. You will realize that the water in it is secreted directly, without passing through any tube. Hence, since the secretions are released directly from the gland, without passing through any duct, then we refer to that gland as the ductless glands. Ductless glands are also known as endocrine gland. The secretions that the endocrine gland produce or releases are known as hormones. Hence, hormones are defined as chemical secretions produced by the endocrine glands that are released directly into the bloodstream to their target organs. The pictures shows the endocrine glands in the body and some of their basic functions. So all you have to study for your exams as an Alveoly E-learning student is to 1. Know the endocrine glands and the type of hormones they produce and the functions of the hormones. 2. If those glands secretes more than necessary, or less than normal, what diseases will it create, and how will their signs and symptoms be presented? 3. If the disease happens, can it be treated medically or surgically, and if it's surgery, how will the patient be prepared preoperative, intraoperative, and postoperative? End of introduction to the endocrine system. Follow the next tuition on Alveoly E-learning to continue with lessons on the endocrine system. You can send your questions and comments to the course instructor on WhatsApp on +2335 4955 6116 for further explanation and answering of questions on the tuition above. Thank you, Alveoly E-learning, making learning easy and providing simple tuition at your doorsteps.